We're going to start, of course, with what's happening with the explosion still of these coronavirus cases. Look at the rising numbers. Let's start with Johns Hopkins University. This is the latest, more than 55 million diagnosed infections around the world. 11.2 million of them right here at home. At least 247,000 Americans dead from this coronavirus.
Yeah, and with these staggering numbers, obviously we understand the human toll, but really focusing again on those healthcare workers that we talked about so much in the beginning of this pandemic.
Yeah.
Now still bearing the brunt of all of these rising numbers. Talk a little bit about healthcare or physician burnout.
Well, that's what's really coming into light right now because, yes, we're assuming that they're under stress, but a recent survey by McKinsey & Company really elucidating what that impact is. So take a look at these numbers. More than 86% of doctors felt, quote, burned out or stressed due to a couple of factors: a delay in patient care, the use of telemedicine, its pros and cons, and financial concerns. The survey went on to find that 54% of physicians surveyed are seeing more complications due to postponing patient care, the patients delaying their own care because of the pandemic. 29% are seeing a rise in treatment costs then associated with this care, both medical and surgical, and 47% of physicians surveyed are concerned that their medical practices will not survive this pandemic. So the ripple effect is significant.
And we're talking about physicians here, but we've been through this pandemic. We've been talking to people throughout. It's not just the doctors and physicians. It's the nurses, but it's everybody in the hospital, down to the people who clean the linens are impacted by what they see.
So again, people have to understand that when you work in a hospital and you're taking care of these critically ill patients, while this survey dealt with physicians who work in private practices and hospital settings, the hospital team is massive. You have PAs, nurse practitioners, nurse anesthetists, respiratory therapists, nurses. This goes on and on. They are suffering, many of them, true PTSD, not only because of what they're seeing, but the hours they're working. They've never faced anything like this before, and there is seemingly no end in sight.
All right, Dr. Ashton, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.